The nation's top COVID-19 expert says a new Omicron offshoot is actually more contagious than any other variant in the U.S. Here to explain is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health.
Hey, Dr. T, great to see you. So the latest CDC data shows that this is what the subvariant is. It's XBB.1.5. Now causes 71.7% of new infections, roughly 72% of infections here in New England. That is a significant increase from only 7% just a few weeks ago. So the question is, it's clearly spreading faster here than other strains, but is it more dangerous?
It's a good question, Ed. It's not more dangerous, but because it's more contagious, because it can evade our immunity, it's leading to more cases. And as you know, as we see more cases, we are seeing more hospitalizations as well. Now, importantly, when I say it's not more severe, it's still severe. There's between 350 and 400 people dying every day in the United States. When you annualize that, that's 100,000 people. Now, we can do better. If we get our vulnerable people vaccinated, boosted, if you haven't been boosted in the last 4 to 6 months, please roll up your sleeves and do that. We can get that number of deaths per day down even further. But remember, we're doing much better than we were a year ago. A year ago, there were 1,400 people dying a day.
Okay, so the CDC says that COVID levels, they are now high for most Massachusetts counties, including Suffolk. In your opinion, is it time to bring back those mask mandates for schools, other public places?
Erica, I think the key is that individuals who are at higher risk, who are vulnerable, who are immunocompromised, multiple comorbidities, that they consider masking, especially when they're indoors for extended periods of time in crowded areas. Now, UMass Boston just reinstated their mask mandate. Do I think that that makes sense? I think if they're seeing lots of cases, it's a way of keeping more kids in the classroom. But again, should we be mandating it across the board? I don't think we have an appetite to do that. The bottom line is when you mask more, you don't get COVID during the times that you're masked. Of course, when we take the masks off, we still get COVID.
So, Dr. T, as you know, the percentage of Americans that are 5 and older who've received the updated booster dose is still very low. It's only about 15.4% or so. But take a look at this. Here in Massachusetts, it's nearly double, but it's still just a little over 28%. If more people got that shot today, what do you think would change?
It's such an important question. And the fact of the matter is we are under boosted, not only in Massachusetts, but in the United States. What the boosting does, it will not necessarily prevent you from getting COVID, but it will decrease the likelihood of you getting hospitalized and the likelihood of you dying. I want to be clear. The vaccines, the boosters have saved millions of lives around the world. We can push that number of 350 to 400 deaths per day. We can ramp that down even further. And we need to do that, but we need the help of those that are vulnerable to make sure that they're boosted.
One quick follow-up question with the booster, Dr. Ellerin. So you mentioned, a couple questions ago, if you haven't been boosted in 4 to 6 months, consider getting a shot. Do you mean for those who have already been boosted with that latest shot? Or are we still kind of once a year? Yeah.
Yeah, great point, Erica. No, I want people who have not gotten that bivalent booster to get it.
Okay.
Dr. T, thank you for your time. It's great to see you.
You too. Have a great weekend.
Dr. Ellerin. You too. To our viewers, if you have any COVID-related questions that you'd like our experts to answer, just email them to ask@wcvb.com.